let me introduce myself. My name is Tara Johnson, and I'm currently coming to you from the open-air second-floor balcony of Hospital Pedro Vicente Maldonado in rural Ecuador. I originally tried to give you all a really good view of the whole town, and I was up in the bell tower of the church on the main street, but I didn't realize that the bells ring every hour, and at 3 o'clock I almost lost my hearing. So I've decided to move to the hospital to do this little video recording. So I'm a fourth-year medical student at the University of Minnesota, and I'm a 2007 Notre Dame grad. My plans when I graduate in a couple of weeks are to enter a one-year Master of Public Health program at the University of Minnesota, and then I plan to pursue emergency medicine with the hopes of probably in the future working 4 to 6 months abroad every year doing international public health and international emergency medicine, and then the other months of the year working in the U.S. to basically earn a living. So I want to thank you, Mike, for inviting me, and I wish that I could be there with all of you, but as I said, I've decided to spend my last month of medical school in this small town in Ecuador, hoping for sort of a culmination of all that I've learned over the past 4 years of medical school. And during this time, I also see it sort of as a prep for my public health studies, because I've been thinking a lot about potential public health interventions and projects that I could potentially undertake in the next couple of years. So I couldn't be happier to be here, but I wish I could be there with you as well. So how did I get involved with Pedro Vicente Maldonado in the first place? Well, in the summer of 2006, which was the summer between my junior and senior year at Notre Dame, I applied and was accepted for a program through the Center for Social Concerns that sent students to random places in the world to be immersed in their life and just to learn as much as possible. So in the summer of 2006, I spent 8 weeks here with a site partner learning about international medicine. And that time was really my first real immersion experience abroad. And I guess you could say it basically changed my life. Kind of cliche, but it's really true. I worked in a local school here teaching science classes and doing labs and stuff, and did a little bit of work in the hospital as well, but mostly the time here was just, I really got a sense of what life was like outside of my bubble in the US. And during that time, working in the hospital and seeing how the hospital worked, I really began to realize the impact this hospital was having on patients, and I knew that I'd eventually want to come back. So at this point in 2006, I was not in medical school. In fact, I was applying that summer for medical school and had to make multiple trips to Quito on a 3-hour bus ride to use the internet, because at that time internet didn't exist in this town. And I knew I wanted to be a doctor, but I just didn't know much about healthcare, health systems, effective health delivery, and I felt like here was a great place to learn. So during that summer, during those 8 or 10 weeks, I interacted with Dr. Gauss quite a bit, because he would use little moments to teach here and there and explain really the idea and the complexity and I guess really the innovation behind this entire project, because it's really a first of its kind and a huge undertaking. And I remember when I was in the hospital, I just remember being really struck by the gratitude of all the patients that I saw sitting in that waiting room all day long to see a doctor, because they had never had that before. Or what they had had was long lines and overcrowded hospitals in Quito, or sort of insufficient care at Ministry of Health hospitals or clinics around the area where doctors weren't available all the time, they were understaffed, they didn't have the right medicines, those sorts of things. This is a new place that people knew, and I knew as I watched, that they were getting really quality care. And it was a very formative summer for me, and it planted a lot of ideas that I guess have really blossomed over the past 5 years for me. With that, I remember, in fact, on my very first drive to Pedro Vicente, I was with Dr. Gauss. It was just a couple days after arriving in Quito. And to get from Quito to Pedro Vicente, you have to go down this really curvy, windy road, basically from the mountains of Quito down to sort of a subtropical area that Pedro is in. And Dr. Gauss is driving like a total maniac, like most Ecuadorian drivers, but I was scared. And we were going through these curvy roads, and we were talking about health and NGOs and all sorts of stuff like that, blah, blah, blah. And I was just trying to stay in the conversation and not look stupid. And Dr. Gauss said to me, if you really want to make a difference in international medicine, public health training is absolutely essential. And at the time I was thinking, my God, I have to apply for medical school, get into medical school, be there for 4 years, and then do my training for residency. And when am I going to have time for that? Do I want to invest the time in that? I didn't know much about it. But him mentioning public health to me, it stuck. And here I am now about to complete my MD degree and enter a year to get my MPH. It was quite a formative summer. For the school year after that summer, which was my senior year at Notre Dame, I was studying pre-med studies also, but I was working on my international peace studies degree minor, and we had to write a huge thesis. And for my thesis, I basically wrote about the healthcare model that Saludeza, the Andean Health and Development, is using as a way of bringing peace to the world. So it's been a really influential thing in my life. So what else? So I guess fast forward 5 years, and here I am again. I'm about 3/4 of my way through my month here. And the time here is certainly not disappointed. I'm working really hard. It's just like doing a rotation in the U.S. at any of the regular hospitals that we do rotations at. And I'm working a lot. I mean, a lot. It's been really nice, but it's been great, and I feel like I'm welcomed and I'm able to learn. And it's been really an exchange of ideas. I mean, the residents here teach me a lot, but they also ask me, well, what do you do in the U.S. and how is this different? And we share these experiences together, and it's become a really, really nice relationship. I mean, for me, this is awesome because it's tropical medicine in vivo, and this is what I'm thinking about doing with my life. I mean, there's snake bites, machete wounds, malaria, these like weird infectious diseases that you have to kind of think that, we never see in the U.S. For me, it's been difficult to identify some things. Rheumatic heart disease, I mean, we never see that in the U.S. But they also get a lot of things here that we do see in the U.S. Peds, sepsis, general surgery, UTIs, kidney stones, abdominal pains, car and motorcycle accidents. I mean, this is a functioning hospital, and they do a lot of stuff. They do a lot of good things for the community. And the residents here are really spectacular too. I mean, they've developed within the system, and they really understand the meaning of providing rural quality healthcare. And I guess, they are the future of rural healthcare in this country. So yeah, and I've been really excited to see how this hospital has progressed in the past 5 years, and I'm also very excited to understand and hear about the process of the development of the new hospital in Santo Domingo. I know that it's going to have a huge impact on people there, and it's also going to be able to enhance the services of people here from Pedro Vicente who at times need to be transferred to a higher care hospital with more resources, and potentially Santo Domingo could really be that. So it's exciting to hear about how this is progressing and is becoming the basis for healthcare delivery in this country, really. I guess that overall, in my limited and humble opinion, I think they're doing things right here, and I feel so blessed to be a part of it and to learn from them and use it as, a potential influence on my career. I know absolutely without a doubt that I've learned a ton here, and I know also that people here have benefited so much from this hospital being here. And I really think the community is better off because of it. With that, I guess I'll stop my rambling, but I just want to say hi to everyone at the Notre Dame Club, and thank you, Mike, for inviting me to share my experiences. Also, big hello to Dr. Gauss. We wish you were here with us in Ecuador, as we certainly all benefit from your teaching and mentorship and general guidance. But I hope you're all doing well, and I hope we'll be able to see each other again soon. With that, I'll sign off, but before I do that, I'll give you a good view of this area in the street here, right around the hospital. It's kind of rainy today, but as you see, this is the street that the hospital is on. This is kind of rural Pedro, and you can kind of see that's the front of the hospital over there, and the big emergency room. All right, with that, I'll sign off. Bye-bye.